Okay, so I want to read something to you about a new study in Nature Reviews Clinical Oncology. They reported that over the last few decades, doctors have been seeing a dramatic increase in cancer in adults younger than 50. So, why do you think we're seeing that onset? Is it lifestyle? Is it environmental? What could it be that we're seeing an increase, especially at a time when we're seeing more technology and more medicine? Cancer still falling in that line of we don't necessarily have a cure.
Right. So we are that's a multi-part. So let me take the first part first.
Yes.
So why are we seeing more? It's multifactorial. The first thing is, of course, we're screening more, and that's not all of it by a long shot, but that's some of it. So we're getting better at screening for cancers. We're in the book we talk a little bit about liquid biopsies, which are basically you can detect cancer on a blood draw that are not leukemia or any of the bloodborne cancers. So there's the screening element of it. But then there's the element of we don't treat our environment very well. You know, even when we're trying to do good things like, you know, make the lawn look pretty for, you know, whatever HOA you happen to be with, there are pesticides. And we know from the weed killer and the leukemia thing, you know, maybe that wasn't the best idea. Just toxins get dumped out into the environment constantly. So our environment has toxified, even though we're trying to be more mindful about not doing that. And then there's the diet end of thing. Now, the article that you references by a Dr. Ogino, and I actually went when you did. I was looking that up and referenced that, and it was amazing. It was a very interesting study. His work is basically saying that the things that we eat a lot of processed food, and we don't think about what that means. When we say it's processed food, that means it's chemically treated. Now, those chemicals get into our body and they can cause inflammation in the gut. This is Dr. Ogino's work. Yes. And it can cause inflammation in the gut. Now, in that first chapter about what is cancer, we talk about cell turnover gives you more opportunities as your cells copy themselves for things to go off. They can miscopy, and if you have the genes or if you just hit it right, you can get a cancerous growth. So the more inflammation you have, the more cell turnover you have, the more opportunities you have for cancer. And that is anybody who's scientifically based or a doctor just cringed, because I just made that as blisteringly, you know, it's probably oversimplification. It's a little bit like saying, how does a plane fly? Well, the air goes over the wings. It's a lot more complicated than that, but at its base, that's what happens. The more inflammation you have, the more opportunities you have for cancer to come about. And that's Dr. Ogino's work. It's fascinating stuff. He's working with a bacteria called Fusobacterium nucleoforme. I probably got that wrong, but you know, it's an interesting line of inquiry, I guess would be the best way to say it. So all of those three things, we find it more. We don't do a great job of keeping our environment clean, and again, our body's clean either. You know, we feed junk into it. If you want the good stuff, you know, shop around the edges of the supermarket. You know, most supermarkets are set up so that the less processed, not unprocessed, but less processed foods, you know, you have dairy, meat, produce are around the sides. The stuff in the middle is usually the overly processed junk.